friends, my name is Cori Garland. I'm an attorney working with clinics and advocates throughout the country to ensure access to abortion care. I'm also a proud Womxn Project volunteer and a board member for Rhode Island's abortion fund, the Women's Health and Education Fund. Despite a global health crisis, there are many people who will need safe abortion care. But with stay-at-home orders, difficulty traveling, and the lack of available providers in many communities, compounded by state and federal policies that deny health care coverage for abortion, the barriers can feel and in too many cases become insurmountable for people who need an abortion right now. Acquiring an abortion does not need to be that difficult. In this time when travel is so limited by the coronavirus pandemic, the Food and Drug Administration could allow people to receive abortion-inducing drugs through the mail. Medication abortion is safe and effective, and it does not need to be an in-person physician visit to be safe and effective. A safe, effective at-home option is critical for people to have rather than forcing them to travel to find a clinic during a pandemic. Many people are using telehealth and online pharmacies to get their health care without having to travel or leave their homes. In fact, in Rhode Island, Governor Raimondo has required health insurers to cover telemedicine appointments. The problem is that right now, the FDA restricts how abortion pills are obtained. These regulations are unnecessary because many of the pills are consumed once the person is at home. And even if a person takes the abortion medication at a health center, they then go home after taking the medication. The abortion actually takes place at their home. But the FDA and states are still forcing people to travel to a clinic during a global health crisis, rather than allowing for telemedicine consultations and the distribution of pills in the mail or through a pharmacy delivery service. Why? Well, let's be clear, it's not for health reasons. Many studies over many years have shown that self-management of abortion at home, using pills and protocols approved by the World Health Organization, is safe and effective. In fact, many countries have been mailing abortion medication pills to expand access for years. It also is something many health experts, including the World Health Organization, have emphasized can address the need for abortion care during the pandemic. The United Kingdom recently issued new guidance authorizing physicians to provide medication abortion pills. The public and British abortion providers immediately embraced the change, knowing that home use is a safe and effective way to experience an early gestation abortion. In the United States, people in 13 states already have greater access to the abortion pill under a research exception, where they are permitted to dispense the medication through mail. And on March 30th, 2020, a coalition of 21 state attorneys general sent a letter to the United States Department of Health and Human Services and the FDA urging them to waive or utilize discretion to allow for pills to be mailed. Hundreds of thousands of people will need an abortion over the next several months. That need doesn't disappear during an epidemic. We need to eliminate barriers to this essential health service. It is time to lift these unnecessary and frankly harmful limitations on access. The National Women's Health Network has a campaign, and activists, health professionals, and advocates from across the country are calling on the FDA to lift the unnecessary restrictions and ensure that abortion pills can be mailed or picked up from local pharmacies. We hope you will join us. And hey, while we're at it, let's get rid of all those ridiculous policies that take away health coverage and make abortion care unaffordable. After all, abortion is essential health care.